breast cancer. And I'd like to dedicate this section of the class to women that I've known personally that have died of breast cancer. So I know Tazret, to her, she was 35 years old, 2011, she died of breast cancer. You hear the age? Last year, sister Nenmet, she was 49 years old, died of breast cancer. I know women now who have breast cancer. Miss Elaine, she's fighting because she's doing the right things. So she hasn't removed the breast, and all she's done chemotherapy, and she hasn't reacted the same way as other females. So in 2011, that's when the whole I would say the whole problem of breast cancer hit me, because then my teacher once said, you know, people, when you watch TV and you see thousands of people killed on the TV, you're watching, maybe there's something and 2,000 people were killed, this happened, it doesn't bother you. Why doesn't it bother you? Because you don't know them. So it's showing you, if something doesn't happen close to you, you don't care about it. So that is a wake-up call for myself that, okay, there's things out there you need to care about. And that's why this class happened today, because then we have to care about what is happening to the race. Where are we going? What's the trajectory path that we're on? So in 2011, I met Tazret. She had breast cancer. She already had a mastectomy. They removed the breast. She didn't survive. They did chemotherapy, they did radiation. Modern medicine cannot cure cancer. And cancer in the breast occurs when the breast tissue, the cells in there, is growing uncontrollably. And that is breast cancer. Eventually, the breast will rupture, so it will just burst. And then you see a form of like a sore right in wherever it, whatever side it is on. Okay? And a lot of women recently, especially in Jamaica, it has increased, because when you look at the amount of women now coming up with breast cancer, it's one of the number one cancers that are killing women now across the world. And then when I say women, it's us by far. So if you had 200 of other races, you'd have 800 of us dying. That's the disparity between who's dying more of breast cancer. So that means we, as a race, we have a problem. We have a big problem. So this is the mammogram, the breast. The breast is stimulated by estrogen. They said, okay, we don't know what causes breast cancer. The same thing. We always say we don't know. They always say they don't know. You have to be careful of that. But then they suggest, like they say, okay, if you remove your ovaries, if you do a hysterectomy, we give you hormone replacement therapy, right? But yet they say, okay, but that has a risk, because the hormones that we're replacing, what the ovaries produce estrogen. So if we're replacing estrogen, because we took out the ovaries, it might cause breast cancer. Are you seeing what is happening? So fibroids, breast cancer, all have a part to play with hormones. Because once the hormones is in excess, then it grows the areas uncontrollably, like the breast, because it's meant for breast growth. So you're taking all these artificial estrogen through the form of cheese, milk, chicken. Then what happens? Then you're susceptible to these types of maladies. And cancer is one of the disease in the Western world that drives the most fear into people. So you can say, okay, I have diabetes, fine. When you say you have cancer, half of them, they're already dead. Because in the mind it's like, okay, I'm dead. That's what most people think. Because you hear them when they get hit with the news, they're just like, okay, I'm dead now. One of the examples I could give you was one of the ladies' name I just called, died last year at the age 49. When she heard she had cancer, she ran. She didn't want to go back. She didn't tell anybody. It started to progress, and what happened? She died. When she seek help, it was already too late because the breast ruptured. Okay? And so that's just showing you when people hear certain things, it drives so much fear into them that they'll just run and not think about, okay, all right, I have cancer now, what's the solution? But you have to be careful of doctors and think that they have some magic potion to help you, because they don't. And I was so horrified in 2011 while researching on breast cancer. I came across this article in the Jamaica Gleaner. The Jamaica Gleaner article that was dated Monday, October 24, 2011, where he had this lady called Miss Pusey, Melrose Pusey. She had a mastectomy. She removed her left breast. And since then, she said her arm has been growing to the point where she can't control it. So she had a normal arm before she did the surgery. But this is what happened to her after the surgery. Now, when a doctor tells a female that she has breast cancer, and then he schedule a removal of the breast for 2 weeks later, that's you're throwing the person in a frantic mode, because you're saying, okay, you have cancer, do this. They don't sit you down and say, okay, you have cancer, these are your options, okay, and we have to schedule a surgery for you. They frighten you. They frighten you to cut it out, because then it's money in their pockets. So it doesn't matter the side effects that it have on you, that's your business. But I just cut off the breast, and there's no clause to say I need to tell you anything. So she's in the article, she's saying, okay, I did a mastectomy at the Kingston Public Hospital, and they removed the breast, and then from then my hand keep growing. I went to the outpatient. They said come on Tuesday. The Tuesday doctor said go to Thursday doctor. The Thursday doctor said go to Tuesday doctor. They hear what's happening? They ping ponging her. Go to Tuesday doctors. The Tuesday doctor said go to Thursday. Thursday said go back to Tuesday, because they don't want to deal with the overgrowth of her arm. So you have to put it in your mind that you are responsible for your own health. You leave it in the hands of people called doctors, and they're not liable for you. So, oh, you're going to say, why you didn't tell me this is going to happen to me? It's your health. Who has the breast cancer, me or you? I'm the doctor. I did the surgery. You have it, so the onus is on you to find out, okay, if I do this, what are the effects that it will have on my body? Nobody asks those questions. I remember being in an office, 2012. A lady called, I'm at the doctor's office, I'm answering the phone, and she says, I heard about this doctor, and I want to come there because I heard that he's very good at holistic health, and when I do a mastectomy, I'm going to come there. I'm going to do a mastectomy next week. And I said, lady, you're going to do what? I said, she said, I'm going to do a mastectomy. And I said, miss? I said, how old are you? She says, 42. I said, you need to consider, have you considered the effects that this will have on your body? She said, no, but the doctor said she should do a mastectomy. He said, did you do any research on what can happen to you after you remove the breast? No, but that's what the doctor recommends. But they don't tell you that these things can happen. It doesn't happen to everyone, but it does happen. So this condition is called lymphedema, where when they remove your breast here, they'll remove lymph nodes underneath your armpit. Okay? And they'll take it out because they said the cancer cells can travel to other parts of your body via your lymph node. It's a route that it takes to go into other parts of your body. So they say, okay, we have to remove it, depending on the severity of the cancer. So if the cancer is more aggressive, it depends on the stage, because you have different stages of cancer. So the earlier the stage, is better, they say, for them to help you. The later it is the less chances you have. So she removed them, and then that started happening. The doctors seemed, based on what she was saying in the article, the doctors don't know what is happening either. But this is common knowledge, but it shows you that the people who are operating, certain people are very incompetent. Because why wouldn't you know? So they didn't know, and because of fear, they said, you know what, push her to the Tuesday clinic. We don't need to see her. And so she doesn't know what's happening to her either. They're in distress because she said her arm weighs 25 pounds. No, that's one thing that happened. And I have a lady that I know very well. She's in her late 70s. So this is one thing that can happen to you. She did a mastectomy in 2014, right? She said there was a lump in the breast. She went to the doctor. They felt it, right? So they said, okay. She said the nurse was saying, it don't feel like cancer to me. But then she said the doctor said, well, it feel like cancer. It's tough because then they described cancer lump as it's hard and it doesn't shift. When you squeeze it, it doesn't shift. But a regular lump like a cyst, it will shift. When you touch it, it will shift. And it's softer. And you can put a needle in it and suck out the fluid that is in there. But a cancer lump is tough. It's hard. And it's not moving, shifting anywhere. So the doctor said, oh, I guarantee you it's breast cancer. So they removed her breast. They shut it on mastectomy. They removed it. Right? Then they send the lump to do a biopsy. She paid $132, she said, to do a biopsy. When it came back, she didn't have cancer. But what happened? The breast gone. But it's just showing you that these people who are meant to have knowledge, they're incompetent. How would you make a mistake like that? This is not a mistake where I stepped on your toe and I can say sorry. You get me? What of the when I take off my clothes and look in the mirror? How should the person feel? When I hear it, I felt like I was upset. And she said, I'm too old to go back to this court and sue them. Because even other doctors were saying, oh, I don't see why the breast was removed. Isn't that horrific? So these are the things that you face when you don't take the responsibility for your own self to say, you know what, I need to look I need to see what's going on. Okay, you say I should do this. Let me see what are the possible risks that I may have to face before I do this. Don't let nobody shove you into a decision without you having to question them back and forth. Because the thing most doctors don't like is for you to question them. Okay, so why are you giving me this? What good for? Oh, I read up on this and I saw it on that this type of ingredient, this type of prescription can cause kidney damage. Is it good for me to take? They don't want to hear those questions. Don't question me, just do what I say. And when there's a problem, what happens? You can't go to them. And eventually you will end up just dead. That was the fate because you didn't take the responsibility to look things up for yourself. That's why ignorance is not bliss. You need to look it up. And once you're interacting or you must come across people, whether it's yourself or people that you know, there must be at some point in time somebody you know that will have to face these things. And you have to be there to help them, to guide them and say, look, go this way, look at this, look at this. These are the facts. These are some of the things that you're faced with. So with that now, breast cancer, okay, what's the cure? Basically, most of our problem is really lifestyle, is diet. What we consume. Breast, ovaries, all of those are reproductive systems, so they have to deal with hormones. So that means the same thing affects one, affects the other. Excess estrogen cause those cells in the body to grow uncontrollably in the breast. Because those hormones in particular affect only certain parts of you. And that's the reproductive parts, organs. So breast cancer, fibroids, cyst, A lot of people have cyst, ovarian cyst. These things don't have to be surgically removed. It's a simple case of a change of diet and knowledge of herbs. Herbs that help to regulate your hormones. Like as I said earlier, donquay, schisandra, um, damiana, red clover, all these things help to regulate the female reproductive system. So you've heard it. Nobody else needs to say anything. You've been served.